What is a floater?
Okay, so the back of the eye is filled up with a gel called the vitreous. Okay, now it's very common to have just normal little floaters, little things floating around in your vision, even as in young ages. So dots, little lines, that's all very common. So what we see a lot of times is as people get older, people have a sudden large new floater come on. And what that can be a sign of is the actual vitreous gel kind of collapsing on itself. That's frequently associated with some of those flashing lights that we were mentioning also.
So if somebody suddenly they've had a couple of floaters and they learned how to see despite them, and there's suddenly a burst of floaters like 30 or 40 that are in front of the eye like that, is that an emergency?
Yeah, I would be seeing something like that within a day or so.
What does it make you think of?
So the main thing you want to make sure is that the eye care professional that you're seeing has to dilate the pupil and make sure there's not a torn retina or a detachment of the retina. So that vitreous gel is adherent to the retina out in the periphery of the retina. And so as it collapses on itself, it can tug on the retina. If the retina gets tugged hard enough, it'll tear.
And if it tears or is detached, what does that mean to your vision?
So again, that's why it's so important to be seen soon. So if we catch a retinal tear before the actual retina has detached, that's treatable with a laser. However, if the vision has gone down and there's a retinal detachment, that can be fixed, but that actually requires a trip to the operating room.
So the symptoms that somebody would have is flashing lights and lots of floaters, and the treatment is going to be seeing if it's a tear. Is that easy? A tear versus detachment?
So it's easy for any eye care professionals can look back there and pretty easily determine whether or not there's a retinal detachment.
You know, the first time when I was in training and I rotated through ophthalmology through the eye and I got to look through a slit lamp, almost changed my direction in life. It's such a beautiful thing to look at, to be able to diagnose eye problems. So the treatment is usually successful. If you get multiple floaters and flashing lights, see your doctor quite quickly.